Ever wondered about the safest way to use abortion pills at home? It's a concern that many grapple with, given the sensitivity and emotional toll of the situation. Today, we aim to provide a comprehensive guide to help you navigate this process safely and effectively. First things first, it's essential to understand what abortion pills are. They are medications used to terminate an early pregnancy. There are two types of pills, Mifepristone and Misoprostol. These work together to end a pregnancy safely and effectively. The initial step is to take Mifepristone. This pill works by blocking the hormone progesterone, which is necessary for the pregnancy to continue. Without this hormone, the lining of the uterus breaks down, and the pregnancy cannot continue. After taking Mifepristone, it's time to take Misoprostol, usually within 24 to 48 hours. This pill causes the womb to contract and expel the pregnancy, similar to a miscarriage. Now, it's important to note that these pills are most effective within the first 10 weeks of pregnancy. After this period, the effectiveness decreases and the risk of complications increases. So, how do you use these pills? The first pill, Mifepristone, is taken orally with water. You can take it at any time of day that suits you, but it's best to take it when you have some time to relax afterwards. The second pill, Misoprostol, is taken 1 to 2 days after the first pill. This can be taken by placing the pills in your mouth between your cheek and gum for 30 minutes. After this time, any remaining fragments can be swallowed with water. It's normal to experience side effects, such as cramping and bleeding, which can be heavier than a regular period. This is the body's natural response to the medication and an indication that the pills are working. After the process, it's essential to have a follow-up appointment with your healthcare provider. This is to ensure that the abortion is complete and that you are recovering well. Remember, obtaining and using abortion pills should always be under the guidance of a healthcare provider. If you experience severe pain, heavy bleeding, or any other serious complications, seek medical help immediately. To wrap up, today we've discussed the safe and effective use of abortion pills at home. This process involves the use of two medications, Mifepristone and Misoprostol, which work together to terminate an early pregnancy. Always remember to consult with a healthcare provider before starting this process, and ensure a follow-up appointment after the procedure. With the right information and guidance, you can navigate through this challenging time safely and effectively. Thank you for tuning in, and remember, we're here to support you every step of the way.